When we think about addiction recovery, it's so much more than just a 30-day program, right? It's a lifelong journey. And for way too long, our healthcare system has really zeroed in on that initial acute phase of care, leaving this huge gap in long-term support. So today, let's dive into what that gap looks like and how communities are starting to fill it.
And that brings us to the real question, the one that matters most. A person walks out of a clinical setting. They might have a plan, sure, but they're walking right back into a world that's filled with all the same challenges and triggers. So what's there for them in that moment? And in all the thousands of moments that come after?
So that question, it really gets at the heart of what's known as the recovery gap. It's that empty space between intensive professional treatment and a person's actual long-term life out in their community. And filling this gap, well, it requires a pretty fundamental shift in how we even think about care.
And this quote right here, it really nails the kind of shift in thinking that's needed. We're moving away from that old school, top-down, expert patient model. Instead, the whole idea is to move toward a real partnership, something collaborative that actually empowers people to be the drivers of their own recovery journey. This visual just lays it all out, doesn't it? We have a pretty clear, well-worn path for detoxification. We have one for clinical treatment. But then, what? A big question mark. And for too long, that question mark has represented this dangerous void, a place where that crucial ongoing support is just missing. And that's where relapse rates can be incredibly high. So how do we fill that void? Well, a new model is starting to pop up. And it's not another clinic, it's not another hospital, it's a totally new kind of hub, one that's designed for the community and often by the community. Well, say hello to the Recovery Community Center, or RCC for short. Now, it's absolutely vital to get this. These are not treatment centers. They are safe, they're welcoming, and they're usually peer-operated spaces that are all about providing the practical and social resources people need to build a real, sustainable life in recovery. You can really think of these RCCs as the new kids on the block in addiction care. They're a relatively recent but incredibly vital innovation. And they're strategically placed right in the heart of neighborhoods where people actually live, which makes getting support way more accessible and helps break down barriers like transportation or just the stigma of asking for help. And look, this isn't just a couple of one-off experiments happening here and there. The rise of RCCs is actually part of a much bigger, coordinated national movement. It's backed by major organizations like the Addiction Technology Transfer Center Network, all working to create a more recovery-focused system of care across the entire country. Okay, to make this really hit home, let's talk about a real-world example. Outreach 419. It's a peer coaching RCC, and it's in the small rural town of Fenwick, Michigan. And get this, it's now serving over 250 people every single week. This just goes to show that this model isn't just for big cities. It's about creating a lifeline by meeting people exactly where they are. All right, so who are the people actually walking through the doors of these centers? The data? It paints a really powerful picture of a population that's facing some of the biggest challenges imaginable. For nearly half, 43% of new members at the RCCs that were studied, their primary substance was heroin or another opioid, which, as you know, puts them right at the epicenter of the ongoing overdose crisis. And then you look at the economic hurdles, and they are just staggering. Over half of the participants, 52%, reported a total household income of less than $10,000 a year. So this isn't just about substance use, it's about deep, profound economic instability. On top of all that, you have the challenge of mental health. A staggering 62% of attendees have a lifetime diagnosis of a mental health condition in addition to their substance use disorder. This really highlights the need for support that is truly holistic. So you start to put all these pieces together and the picture becomes crystal clear. RCCs are successfully attracting and engaging the very people who need support the most. Individuals who are facing these huge, overlapping clinical and social challenges.
Okay, so we've got a good idea of who these centers serve, but what actually happens inside an RCC? I mean, what does that support look like on a day-to-day basis?
This table is super interesting because it shows you this amazing blend of services. Now, peer support is obviously the cornerstone. All recovery meetings is the most used service. But look at how high practical help, like employment assistance, ranks. This really shows that places like Outreach 419 get it. They understand that recovery is about building connection, yes, but it's also about building a concrete foundation for a whole new life. Now this gets right to the soul of the RCC philosophy. It's actually used as a fire starter in trainings to really shift mindsets. The immediate goal isn't perfect abstinence. It's about igniting hope. It's about meeting people exactly where they are, no judgment, and just proving to them that a different future is actually possible. So at the end of the day, the entire vibe, the entire environment is designed to build these three things: hope, connection, and purpose. It's not just about stopping something negative. It's about starting something positive. It's about building a meaningful life, a life that's worth protecting.
But the million-dollar question is, does it actually work? I mean, that's what we all want to know. So let's take a look at what the research shows about the real impact of participating in an RCC. The numbers here are pretty powerful. After just 3 months of being involved with an RCC, the percentage of members who reported having no substance-related problems in their lives jumped dramatically, from just 39% at the start all the way up to 65%. That is a huge shift in day-to-day stability.
And this chart just makes it so visually obvious, right? That leap from 39 to 65% in problem-free status is massive. What that represents is a huge reduction in the daily chaos and harm that addiction causes. It's a real, tangible improvement in people's actual lives. And you know what's really cool? The benefits go way beyond just substance use. The same study found significant improvements in things like psychological well-being, self-esteem, and just overall quality of life. This shows that RCCs, places just like Outreach 419, aren't just helping people stay sober. They are helping them build better, fuller, richer lives. So what's the magic ingredient? What's the secret sauce that makes all this work? It all comes down to building what's called recovery capital. This is the key concept. It's the sum of all the resources, personal, social, community resources, like a job, a safe place to live, supportive friends, a sense of self-worth, everything a person can draw on to sustain their recovery for the long haul.
And all of this leaves us with one final and I think really critical question for the future. We can see how incredibly effective these community hubs are at building that recovery capital that people need to stay well. So the challenge for all of us now is this: how do we move them from being the new kids on the block to being a fully integrated, essential piece of our formal healthcare and justice systems?